heart patients rejoice. Angioplasties are set to become cheaper with the NPPA or National Pharmaceutical Pricing Authority slashing prices of life-saving coronary stents by 85% to 29,600 rupees. Till this order came about, a stent cost between 40,000 rupees to 2 lakh rupees. While patients and public health organizations are naturally enthused, the industry is in a state of shock. Here's a special report.
In a major relief to lakhs of heart patients across the country, the National Pharmaceutical Pricing Authority brought down prices of life-saving coronary stents from 1.2 lakh rupee to 29,600 rupees. What this essentially means is that all kinds of stents, imported or domestic, will cost the same amount. This move has been brought about after hospitals were allegedly charging patients exorbitant amounts with a markup of more than 100%. Public health organizations are naturally enthused.
As you know, the Ministry of Health's expert subcommittee had noted that there is a massive unmet need. And we feel that capping the price at what they have done, which is around 7,000 for bare metal stents and 30,000 for drug-eluting stents, will actually ensure that it improves accessibility and affordability of the stents.
The National Pharmaceutical Pricing Authority has also mandated hospitals bill cardiac stents and procedure package separately. Hospitals Magic Bricks now contacted say that although there was a bit of confusion the day this was notified, they have now told their suppliers about the change and have started to implement it.
So all hospitals will have to fall in line, no? And they have to charge the same price, whatever has been suggested. And that is 29,600, the optimal price for a stent. And whatever adjustments the hospital and the manufacturer and or supplier makes, that they have to do it immediately, no?
But the industry is still in shock. Foreign stent manufacturers, who will be the worst hit, say that this could further hamper innovation in coming times.
When people come up with better or newer or more efficacious products, they'll perhaps target other markets first and then target India after they gain scale in those markets, because India is not going to remain as profitable for those innovative products.
Domestic stent manufacturers whose stents cost much lesser than foreign-made stents say that the government has not given them any transition time.
I can't imagine doctors telling the patients that I will not do surgery until I've got clarity from the suppliers. And if the doctor continues with the surgery and he sends credit notes across to the distributors, and distributors expect this will be settled by the manufacturer, this is going to cause lots of hardship.
However, public health organizations contend that there is no scientific data to prove this statement, considering the prices at which these stents are manufactured is much lower. Despite the industry pointing out a number of challenges when it comes to fixing ceiling prices for cardiac stents, good news is that the number of angioplasties and the number of patients who can afford to undergo these treatments will only increase. This is Amata Balachandra for Magic Bricks Now.
You can watch live TV on our website mpnow.in. Find us on Facebook at facebook.com/magicbricksnow. And don't forget to click the like button. You can also follow us on Twitter at Magic Bricks Now. To stay updated with all our programming, hit the subscribe button on our YouTube channel by logging on to youtube.com/magicbricksnow.